Hi, this is Jamie Davis, the Podmedic, and I'm here with Pat Songer from Humbolt General Hospital. He's the director of EMS there, and that's in somewhere in Nevada. I'm going to let you pronounce the name, Pat.
Winnemucca, Nevada. We're 170 miles east of Reno on I-80.
And you were talking yesterday about some of the amazing things you've done to implement some advanced practice techniques in community paramedicine, but also in just general EMS practice into your system yesterday. Tell me some of the things that your system is, that you're really excited about that your system's doing.
Well, currently we're under a pilot program for ultrasound studies, seeing how we can expedite trauma patients to a trauma center without having to bypass a critical access hospital. We're looking at the feasibility of do we need to bring patients to the hospital? Can we go out in the field and do assessments, do treat and releases with it? See if we can involve it more into the community aspect, more into the financial and well-being of the community rather than just the health well-being of the community.
One of the things that really caught my ear when you were talking yesterday was your placement of AEDs and public access to CPR education and public access to AEDs in your community. I was really impressed with some of the numbers that you were talking about. What were some of the things that you did that really helped you get that program initiated?
Well, first off, we went after a grant. We had a state-funded grant that allowed us to purchase about, I think, 40 AEDs. Then after that, the hospital just saw the feasibility of the AEDs. Everything we do in the rural community is trying to shorten the system time. So obviously an AED is a component of shortening the system time. We do not have first responders, so we incorporated the police department, sheriff's department into our first response program. It just became an intricate role of the AED program, public access to defibrillation, especially in a rural area where we have such diverse times. Anything we can do to shorten that time to shock, as you know, we don't need to educate anybody on an EMS, but that's what we're trying to do. So it becomes a very critical component with sudden cardiac arrest in the rural areas. So we started off with that about 40. We're about up to 200 AEDs now through a lot of cooperation through the mining community. They purchased a lot of them, put them on their buses. Actually had some real good saves on buses from returning home and cardiac arrest on the bus. We actually had a save on a bus. So the program has been very successful in that sense. We're not like a big city of Seattle where we can have the 4-minute response times everywhere, but we can train the first responders, the public, in the use of AEDs and CPR. So.
What would you say to a system that's trying to implement a public access AED system in their rural community? Yes, there's grant dollars out there at the state and federal level, but as far as overcoming hurdles with businesses and organizations to put this medical device in their building,
you know, we got corporate buy-in through the safety aspect of it, that in the long run, it's you're more liable not to have an AED than you are to have an AED. I think the big fears of having AEDs, we're liable for the use of them, but now that, you know, they're just a push-button toy, my 4-year-old son could use an AED. So I think that where we sold it to the casinos and to the corporates, to the mines, was, hey, if you don't have this AED, because it's so readily available, you're going to be more liable without than you are with. So they really bought into the program and then saw, you know, it only takes 1 or 2 saves and everybody starts buying in real easily.
Great. Pat, thanks very much for sharing some stuff with me here and with the listeners of the Medicast.
You bet. Thank you.